Now, that being said, I'll turn it over to our host tonight, Carla Zednick-Slicer. Go ahead, Carla.
Hello, first day of spring. We're excited about that. I'm sure everyone is. So as Dave said, I'm Carla Zednick-Slicer. As many of you know, I am both an advisor and the president of ClearStep Financial. I also would like to welcome you to tonight's webinar on Medicare and long-term care presentation. Our goal at ClearStep Financial is to help educate and guide our clients through the ever-changing financial world, as we all know. To help us accomplish this goal, tonight I am pleased to introduce to you a special guest speaker on Medicare. We have Nikki Johnson, and Nikki's that smiling lady there. We appreciate you. And she's an advisor with FHK Insurance. She does Medicare both in Wisconsin and Minnesota. And how many states, Nikki? About 20 states?
Yep, about 20 states now. So wherever you need me to answer Medicare questions or be that Medicare resource, I'm available, which is great.
We appreciate that. And then on long-term care, we have Jared Taggart, who is president of Annuity VIP. I believe you will find the presentations educational and informative tonight. So, and then we will also post this on our website later on. So we will start with today's topic, Medicare with Nikki Johnson. So thanks, Nikki.
Thank you. Welcome, everyone. I am so excited to be here to talk to you about the wonderful world of Medicare. We'll just go ahead and get this presentation up and then get into the fun. All right. Hopefully everyone can see my screen okay. As Carla and Dave mentioned, I am Nikki Johnson with FHK Insurance, and I'm a licensed health insurance agent, and I have been in the Medicare world for 14 years, and have I seen a lot of changes, but all good things. So that's the plus side. I do work with FHK, and FHK is the state's largest and oldest senior brokerage firm. We are a family business, and we're the largest independent agency. So when you are a broker, it's kind of a neat thing because you have access to every single company that's on the market. So health insurance is no longer one size fits all, and it's definitely geared to your individual situation. When you are a broker, you have access to lots of plans, and Medicare and health insurance in itself can be confusing. As an advisor, it's my goal to make everything crystal clear and easy for you to understand when it comes to that confusing world of health insurance. When you are taking a look at the topics and presentation for today, I will ask that you hold any questions until the end. I will allow some time for questions. So if something does pop up throughout the presentation, feel free to pop it into the chat or write it down. And once I'm through with my portion, we'll do a little Q&A because I know there's lots of questions that are tied to those Medicare facts. So quick peek at the agenda. We'll talk about the history of Medicare, the different parts of Medicare, the eligibility and enrollment periods. And that eligibility and enrollment is very important. The coverage choices that you have. So there's a lot of options when it does come to Medicare plans. And then whether or not you should enroll in Medicare and what that would look like. The differences between the Medicare supplements and Medicare Advantage plans, prescription drug coverage, and additional resources. So what in the world is this crazy thing called Medicare that we hear about? Well, Medicare started off in 1965 and benefits began in 1966. When Medicare first came out, it was very basic. It just offered coverage for Part A and Part B. So it wasn't until the early 2000s that we had access to prescription drug coverage and the Medicare Advantage plans that you see so much information about these days. Now, most people that are enrolling in Medicare are going to be 65 or older, but there are situations where you can be eligible for Medicare if you're under 65. In the 70s, Medicare was expanded to include people with certain disabilities and also those that were collecting Social Security disability. So it has come a very long way from 1965. As of August of 22, we have over 65.5 million people in Medicare and about 13,000 age in every single day. That's a lot of numbers, a lot of people going in Medicare. So it's a great time to be a Medicare expert. When you are taking a look at those parts of Medicare, you're going to notice Parts A and Part B. Now, Medicare Part A is going to cover your hospitalization. So this is what we consider premium-free health insurance, meaning if you've worked about 40 quarters, which equates to about 10 years, you will not have to pay for Part A. You are automatically eligible to enroll in this. If you found yourself in a situation where you haven't worked that entire time, you are able to buy into Medicare, and that would depend on how many quarters you've worked and also if you have any spouse or family members that you could draw benefits from. When you are looking at Part A, this is just going to cover inpatient hospitalization. So think a hospital. When you are looking at these benefits now, you are going to have deductibles and coinsurance that's going to be associated with this. So some people say to me, Nikki, I am A-okay with just Medicare on its own, but that's not always the case. You do want to make sure that you have some kind of plan to fill in those gaps so that you're not left with a lot of out-of-pocket costs. Now, if you're currently working and you are on an HSA, you do want to make sure that you stop contributions at least 6 months before you start Medicare, because you could be faced with some tax penalties or tax ramifications. But I'll touch a little bit more on that in just a few slides. Medicare Part A does have a deductible, and that deductible will change every single year. So for 2023, our Part A deductible is $1,600. Now, what that means is if you were to hop into a hospital and have an inpatient surgical procedure and you didn't have anything else to cover those gaps, you would have that $1,600 deductible, and then Medicare would cover 80%. You'd have 20% coinsurance. But the interesting thing is that that deductible is going to be per benefit period, and Medicare sees that benefit period as every 60 days. So very important that you have some kind of coverage to fill in those gaps. Part B is going to be a little bit different, and this is going to cover your doctor services. So think about your primary care visits or your specialist visits, any diagnostic testing that you might need, like CT scans or MRIs. All of these medical benefits are going to be covered by Part B. Now, Part B does have a monthly premium, and that monthly premium is going to be income dependent. So depending on what your income was in 2021, that's what Medicare is going to decide what your monthly premium will be. When you are looking at Part B, you will have an annual deductible of $226. Once that is satisfied, then Medicare is going to come in and cover 80%. You would have 20% coinsurance. So this deductible will change on an annual basis, but unlike that Part A deductible, this is a one-time deductible. So it's not going to apply to things like your preventive services, but if you have a doctor visit to check on a prescription or get some blood work, that will play a part when you are having to pay that Part B deductible. As I mentioned, Medicare is income-based. So depending on what your modified adjusted gross income was in 2021, and also whether you're a joint or individual tax filer, that is going to depict what your monthly Part B premium is going to be. Now, standard premium for Medicare is going to be $164.90. If you are collecting Social Security benefits, this Part B premium is going to come off your Social Security check automatically every single month. If you're not collecting Social Security just quite yet, Medicare will send you a quarterly bill to pay that Part B premium. Now, depending on where your income falls, you may be assessed with what's called an IRMA, or an income-related monthly adjustment amount. And that basically means that you will pay a higher premium on the Part B side as well as the Part D side. So lots of things to take into account when you are exploring Medicare. Just like we had an alphabet in school, we have an alphabet with Medicare. So Parts A and Part B are going to be administered by the federal government. Remember, Part A is going to cover your inpatient hospitalization, and Part B is going to cover your doctor services. Part C and Part D, these benefits are going to be administered by private companies. So Part C is also known as a Medicare Advantage plan or an MAPD plan. This is going to encompass all the parts of Medicare, so your doctors, hospitals, and may even include prescription drug coverage. Part D is going to cover prescription drugs all on its own. So it's kind of interesting. We didn't have any prescription coverage or help with covering prescriptions until Part D was launched in 2006. So it's kind of interesting to think about the fact that so many people went for so long without having prescription coverage unless they were on an employer plan. So let's take a look at who is eligible to receive Medicare. Well, those 65 and older are eligible to initiate their Medicare. If you are under 65 and you've been on Social Security disability for 24 months, on that 25th month, you are automatically going to be enrolled in Medicare and you will be eligible to enroll in a Medicare plan. If you have certain health conditions like end-stage renal or ALS, you will also be enrolled in Medicare. You do automatically receive Part A if you are collecting Social Security. If you're not collecting Social Security, there's a few extra steps that you'll have to go through. Now, there's a few timelines that you want to pay attention to as well. And I'd have to say the most important timeline when it comes to initiating your Medicare is going to be your initial enrollment period or your IEP. So this is going to kick off 3 months before the month of your 65th birthday. So during that time, you'll receive lots of flyers, mailers, phone calls, and you're going to be bombarded with all things related to Medicare. But you may not necessarily have to enroll in Medicare right during your initial enrollment period, especially if you're still on an employer-sponsored plan and you're a full-time employee. But if you are not on an employer-sponsored plan and you don't have access to a group plan, you will want to enroll in Medicare using your initial enrollment period. Now, if you're collecting Social Security, that Medicare card is going to arrive automatically 3 months before the month of your 65th birthday. If you're not collecting Social Security yet, you do have the option to enroll in Medicare benefits only, either online by visiting ssa.gov or by calling Medicare directly. When you are taking a look at that initial enrollment period, it is imperative to follow those dates, because if you don't follow the dates and timelines correctly, you may be assessed with a late enrollment penalty that will continue the entire time that you're on Medicare. But that's where a lot of fact finding comes in to figure out when that timeline is going to happen and when you're going to start Medicare. Now, if you're not utilizing your initial enrollment period, but you're coming from an employer-sponsored plan, you'd qualify for a special enrollment period. And this can happen at any point throughout the year. So another thing to think about too, when you're looking at these employer-based plans and that special enrollment period, if you have a large employer that you're currently working for, meaning more than 20 employees, you are able to postpone Medicare until you're ready to retire. If you have a small group though, so less than 20, you do want to make sure you enroll during your IEP or your initial enrollment period. As I mentioned earlier, there are some late enrollment penalties that can pop up. So if you don't have a creditable coverage option through your employer, or you don't enroll in Medicare when you're first eligible, you will have a 10% late enrollment penalty that will follow you in Part B as well as Part D. So pay attention to those timelines. If you're working and you have a health savings account, you're not able to contribute to that HSA once Medicare starts. If you are over 65 and not utilizing Medicare benefits, but you're thinking about retiring and possibly utilizing that special enrollment period, you do want to postpone your HSA contributions 6 months before you start Medicare. If you don't do that, you could be faced with some tax penalties, but it's always good to consult a tax professional just to make sure that you don't have any of those penalties. So essentially, if you're working past 65, you have great choices and you have lots of options. You are able to continue on that employer-sponsored plan, but depending on what the premiums and benefits might be like, it may be advantageous for you to hop off that employer-sponsored plan and enroll in Medicare directly. But few factors that you will want to consider: what's the monthly premium like on that employer plan? What are the plan benefits like? Do you have large deductibles and coinsurance that you have to meet? Do you have certain prescriptions that are covered at a lower out-of-pocket cost? So as I mentioned earlier, health insurance is not one size fits all. So you do want to take all these factors into account. Now you're ready to enroll in Medicare. What happens next? Well, a couple things. You are faced with that decision of what plan will fit your needs the best. Now, you do have two options when you are looking at benefits. The first plan that you can look at is what's called a Medicare supplement, and this fills in the gaps of Medicare. One thing to keep in mind is that Medicare supplemental plans do not include prescription drug coverage. So you do want to make sure that you have access to creditable prescription drug coverage either through a standalone plan through a private company, or if you're a Wisconsin resident, you can enroll in senior care, and that's eligible for Wisconsin residents 65 and up, another way to add that creditable coverage. You can also look at a Medicare Advantage plan, and that type of plan is going to encompass all the benefits of Medicare. When you are looking at Medicare supplemental plans or Medigap plans, this is definitely the easiest type of insurance to use. So Medicare is going to remain primary, and anything that you do as far as doctor services or treatments will be going through Medicare first, and then the balance is going to be sent over to your supplemental carrier. This way, you're not left with those large deductibles and coinsurance that I was talking about earlier. Typically, you don't have a lot of prior authorizations or referrals, and you have access to any Medicare participating provider. This type of insurance plan will also travel with you. So as you travel throughout the United States, the Medicare supplement plan will travel throughout the United States. When you are looking at these Medicare supplements, you really need to think about what a typical year looks like for you as far as doctor visits go. So if you know you're going to have a lot of doctor visits or maybe some treatments that are happening and you want an easy type of insurance plan to use, you might want to look at that Medicare supplement. Keep in mind, you do need to add prescription drug coverage. And when you are looking at these choices, there are a lot of options out there. Some things that Medicare supplements will not cover will include vision, dental, hearing exams, gym memberships. But again, these supplemental benefits are going to vary between states as well as counties within that state. So there are a few supplemental plans that will have some extras, but that's going to be based on your zip code and where you reside. So Medicare supplements will not cover everything. Your next option is Medicare Part C, or the Medicare Advantage plan. Now, Medicare Advantage plans are offered by private insurance companies, and Medicare is paying these insurance companies to cover your Medicare benefits. When you are looking at your Medicare Advantage plans, it's going to encompass all types of Medicare. So access to hospital stays, doctor visits, prescription drug coverage. There are certain timelines that you need to follow in order to enroll in a Medicare Advantage plan as well. So that most common timeline is going to be the annual enrollment period, and that falls between October 15th and December 7th. If you are first turning 65 or your initial enrollment period is starting with Medicare, or you're getting ready to retire, you will also have an enrollment period to go into a Medicare Advantage. We even have a special enrollment period that happens from time to time where certain companies may have a 5-star rating in Medicare, and they're able to have an enrollment period that takes place the entire year. So Medicare Advantage plans are very unique. With these plans, you will have low to no monthly premiums. You do have a series of co-payments or co-insurance, but the nice thing with your Medicare Advantage plan is that you have a safety net. So these plans will have what's called a maximum out of pocket, and that's going to protect you or put a cap on your annual expenses. Preventive services will be covered by the Medicare plans, and anything that Medicare covers, the Medicare Advantage plan will cover as well. But you will see some extras that appear on those plans too. A lot of the common extras that are out there now are your gym membership or vision, dental benefits, over the counter. There's even transportation benefits, and these extras are going to vary by plan, and that will vary by county and also by state. So there's a lot that goes into finding a good option for you when you're looking at Medicare. If you currently have a Medicare Advantage plan and you're happy with the benefits and how that plan works, you don't have to re-register for that plan every single year, but you do have the option to review and make changes. So during that annual enrollment period that happens from October 15th until December 7th, that's when a lot of people are making their plan changes, and they're taking a look at the benefits and how their doctors are covered and whether or not it's an HMO or a PPO and what types of extras they might want to see in their plan. Usually when you're enrolling during the annual enrollment period, your plan will start right away on January 1st. Now, if you have that plan in place on January 1st, but then all of a sudden you go to use it and it doesn't work like you thought it might, you do have the option to change from one plan to another during the open enrollment period, or OEP. And that's what we're in right now. So this happens from January 1st until March 31st. And During that time, you have the option to move from one Advantage plan to another, or you can return to original Medicare and enroll in a Medicare supplemental plan. When you are taking a look at prescription drug coverage, even if you don't take prescriptions, you want to make sure you have some kind of creditable coverage in place. Now, Part D started in 2006. Before that, we did not have any help when it came to the cost of those prescriptions, unless you had an employer-sponsored plan or some kind of private insurance plan. When you are exploring Part D, you are going to have different formularies or a list of covered drugs, and those formularies are going to vary from company to company. Some formularies might have every single drug that's on the market. Some might have just a few prescriptions. So when you are looking at your Medicare options, you do want to take those prescriptions into account, because that's what you're going to be taking every single month. You might not necessarily be running to the doctor's office every month, but you will take those meds. And you do want to make sure that those meds are covered on that formulary and that they are cost effective. Now, when you are looking at these prescription drug options, this can be purchased as a standalone plan utilizing Part D, and that works in conjunction with a Medicare supplemental plan. If you opt to enroll in a Medicare Advantage plan, you could have prescription coverage built in. There's also Medicare Advantage plans that don't include prescription drug coverage. If you opt for a Medicare Advantage plan that does not include prescription drug coverage, you either want to utilize senior care if you're in the state of Wisconsin, or if you're a veteran and you have access to the VA benefits, you can get your prescriptions that way as well. And that's considered creditable coverage. So it is optional, but highly recommended. If you don't have creditable coverage, either through an employer-sponsored plan or senior care or the VA, you could be assessed with a late enrollment penalty. And unfortunately, that penalty is going to cover you the entire time that you're on Medicare. Now, if you're over 65 and you're still on an employer-sponsored plan with more than 20 people and it's considered creditable coverage, you won't have to worry about that late enrollment penalty. But if you don't sign up for Part D when you're first eligible, so either turning 65 or getting ready to retire, you do get that late enrollment penalty. If you don't get it signed up, you usually have about a 63-day window somewhere in that ballpark to make sure that that prescription drug coverage is in effect. Now, understanding a plan's formulary is extremely important because every formulary will vary by company and carrier. So most of your maintenance medications are going to be covered as a tier 1 or a tier 2. And this is going to include things like your preferred or non-preferred generics. So those medications that you're taking for maintenance meds, like simvastatin for your cholesterol, or lisinopril for blood pressure, metformin for diabetes. These are typically going to be a tier 1 or tier 2 med. You may have a tier 3, 4, or 5 med, and that is going to be known as a brand name or a specialty medication. Those are usually going to have a higher copayment associated with them and may be subjected to a Part B or Part D deductible. Now, beginning January 1st of 2023, the Part D and Medicare Advantage plans have been covering the shingles shot at a $0 copay, along with a tetanus shot. So for the longest time, we did have to pay a copay, maybe even a deductible for that, but now we do have that covered. When you are changing your insurance plans, there's a few different timelines that you want to take into account. If you are starting with a Medicare supplement or a Medigap plan, remember that's that plan that's going to fill in the gaps of Medicare, not have as many networks or prior authorizations, and whatever Medicare covers, that Medigap plan is going to cover. You can change those plans at any point in time throughout the entire year, but you may be subjected to medical underwriting, meaning you have to answer a series of health questions, possibly give the insurance company medications that you might be taking. And if you're able to answer no to all those health questions, you would be able to change your Medicare supplemental plan. The biggest reason why people change their Medicare supplement plan is because the premium increases. So you will have a little bit of a higher premium as time goes on. Sometimes you might have an increase when it's your birthday, or if the company does an overall increase, they're going to pass that increase on to you as well. But rest assured, your Medicare supplemental carrier is going to notify you approximately 30 days before that premium increase is going to take place. So sometimes that does give you enough time to explore another supplemental plan, or you might even have the opportunity to go into a Medicare Advantage plan that has that 5-star special enrollment period throughout the year. You're able to change Medicare Advantage plans at certain times throughout the year as well. So the annual enrollment period, that's going to be the biggest time when people are changing from one Advantage plan to another, and that's going to take place from October 15th until December 7th. Now, during the open enrollment period that happens from January 1st until March 31st, that's where you also have the option to change that Medicare Advantage plan or return to original Medicare and enroll in a traditional supplement as well. You do have special enrollment periods that will pop up from time to time, and these are going to be situation dependent. So the most common special enrollment period that does pop up this time of the year is going to be someone that's starting Part B or retiring. So they're leaving that employer-sponsored plan. And that is going to grant you that special enrollment period where you can enroll in a Medicare plan of your choosing. Few things to keep in mind, though, when you are looking at those Medicare plans, you do have to be enrolled in Part A and Part B, and you do have to live in the plan service area. So that means that you have to have a physical address in the county that you would like to enroll in a plan. Doesn't necessarily mean that you have to do your doctoring in that specific area, but you do have to have an address in that specific county. Now, if you move from one county to another and the plan that you had in your original county is not available in that new county that you're relocating to, that would also constitute a special enrollment period. If you enter a skilled nursing facility or a long-term care facility, that also creates a special enrollment period. So there are a lot of special enrollment periods that are out there for Medicare. We have a special enrollment period book that's about this thick. So lots of fun reading materials that's in there. And if you want to know more about those special enrollment periods, just let me know because we have a ton of them that are available. You will see these changes from time to time, but rest assured, when you do qualify for a special enrollment period, you have easy access into another plan of your choosing. When you are exploring the Medicare plans that are out there, there's a lot that goes into finding a plan that is right for you. So health insurance is not one size fits all. What works for a friend or a family member might not necessarily work for you. So you do want to take a couple of things into account when you are exploring your Medicare options. You want to think first about your doctors and your health facilities. So you do want to make sure that those doctors are going to be in network and those health facilities are going to be in network. With the Medicare Advantage plan specifically, if you enroll in an HMO or a health maintenance organization, that type of plan is typically a network-based plan, meaning you have to stay within the network of providers unless you have an emergency or urgent care situation that pops up. When you are looking at a PPO or preferred provider organization, that's going to give you a little bit more flexibility where you would have access to an in-network and an out-of-network doctor. So as long as those doctors or health facilities accept Medicare assignment, which pretty much most of the facilities do, I haven't really run into any situations where someone hasn't accepted Medicare assignment, the plans will work with you. Now, the Medicare supplemental plan is going to be a little different because that Medicare supplemental plan isn't necessarily going to have a network that you have to stay within. You just want to make sure that the doctor or the hospital that you want to see does accept Medicare assignment. And again, whatever Medicare covers, your supplemental and that Medicare Advantage plan are going to cover as well. You do want to think about your current prescriptions because that is something that you're going to be taking on a monthly basis or maybe even every 90 days if you do mail order. So you want to make sure that those prescriptions are covered and that you are getting those for a very low out-of-pocket cost. When you are evaluating your prescription coverage, there's going to be a differentiation in pharmacies that you can utilize as well. So some plans might have a preferred pharmacy, some might have a standard pharmacy, and believe it or not, that can make a difference in how much you pay out of pocket for those medications. And then you want to think about what I like to call your wish list or what other things that you might want to see in your plan. So if you're someone that knows you have a lot of dental work that's coming up, you might want to look at a plan that has a lot of dental benefits embedded. If you want to have access to a gym membership or transportation for non-emergency visits, you might want to look at a plan that has that embedded. Or if you're someone that doesn't necessarily do a lot of doctoring, but maybe you take some supplements like vitamins, you might want an over-the-counter benefit built into your plan. So there have been so many changes over the course of the year when it comes to Medicare plans and plan design that it's not one size fits all. And it's kind of interesting to see how much the Medicare Advantage plans and Medicare as a whole have changed over the course of the years. So get that wish list ready if you are getting close to 65, or if you're thinking about retiring now that the spring is coming and you want to get your Medicare set up for the summer. Start thinking about what's important to you and what you want to have in a health plan. That's really the unique thing when it does come to Medicare, because we do have so many different options. When you are working with a broker like myself, I have access to all those options. So here in Wisconsin, we have a ton of Medicare Advantage plans as well as Medicare supplemental plans, but the other states that I work with as well have a ton of options too. So those states are going to have different plans than we have here in Wisconsin. So again, everything is going to be tied to the county or zip code that you are in, and plans will vary from state to state. But the best part about FHK is that my services are completely free. There's a wonderful team behind us as well. So we do have in-house customer service as well as a claims representative. But getting that evaluation for Medicare at no cost is pretty top-notch for sure. We've been around for over 50 years and do have that A+ rating with the Better Business Bureau. So we are very proud of that. Now, of course, using an insurance agent like myself is a great way to get some resources, but you do have access to additional resources as well. And I'm always recommending that people take a look at what's out there just so you do make a good decision when you're getting ready for Medicare. Medicare.gov is going to be a great starting point where you are exploring how Medicare works in the different parts of Medicare. SSA.gov is going to come in handy for you if you're going to do your initial enrollment period into Medicare, but you're not collecting Social Security yet. And then, of course, CMS.gov, or the Center for Medicare and Medicaid Services, that's going to have a lot of information as well. And then every county usually has an ADRC, or an Aging and Disability Resource Center. When you work with someone at ADRC, you will have access to non-biased opinions when it comes to benefits. So you pretty much tell them your prescriptions, your doctors, and they can give you the plans that are out there, but they can't necessarily help you enroll in the plans. Now, you've heard a lot from me. I am ready to open it up for questions. I cannot thank you enough for joining us tonight on our Medicare 101. Medicare might be a little confusing, but I try to make everything easy to understand, and feel free to use me as a resource, email, call, whatever you need. I am just a phone call or email away.
Okay, thank you very much, Nikki. That was a
You
wonderful
are welcome.
presentation.
Thank you.
Do we have any questions out there for Nikki? We have a couple minutes here before we go to our next portion. If you have any questions, you need to unmute yourself. Other than that, we'll maybe circle around back if you can hang on, Nikki, and we'll see some questions come up after the next portion here. So
Perfect. Sounds good. I'll be here.
Okay. Thank you, Nikki. Hello, Jared. Are you out there? I believe he is. There we have a presentation slide.
Can you hear me?
And we can hear you, Jared. Thanks for joining us this evening. Jared, as mentioned, is president of Annuity VIP, been in the industry a long time, and he's here to talk to us about long-term care this evening. So, Jared, go ahead.
Appreciate it. And thank you to the ClearStep team, David and Carla, for allowing me to present tonight. Great job, Nikki, too. In my previous job, I managed about 2,200 Medicare agents, and that's one of the best presentations I've ever seen. So, great job. Dare I say you make fun. So, nice job there. So let's go on to another topic, planning for long-term care. And just wanted to run you through a few things. Again, my name was Jared Taggart. As David mentioned, I'm president of Annuity VIP. Annuity VIP is a regional brokerage. We have call-on agents and advisors in 8 different states. I've been in the business for 15 years and always have worked primarily on the insurance side, life, annuity, and long-term care. And I will say long-term care is a very personal topic for me. My mom ran a nursing home for 32 years. So I feel like I kind of grew up with long-term care, and I've seen it from both sides. And my grandma was in a facility from age 76 to 104. And God bless her, she did pass away. But so long-term care really is a personal topic for me. I'm happy to say too, not only am I a vendor of ClearStep Financial, but I'm also a client. So I kind of can see it on both sides. So I work with them on the insurance side and get all my investing advice from Cassandra Brazier. So a little shout out for ClearStep here. What we're going to cover today, and Dave, how long do I have? About 2 hours to talk? Just kidding. That was just a joke. You don't have to unmute yourself, Dave. For the agenda today, trends in long-term care. We're going to talk about some of the costs of long-term care. We're going to go into some of the strategies for planning. You know, how am I going to plan for long-term care? What are some of the main things that I can do? And also, what are some of the strategies for success? You know, what's out there? And just like every client situation is different, every product's different. We're going to keep it high level, product agnostic, but what are some of the strategies for success? And then also, what are some of the next steps? What can I do to help prepare myself? As always, there's going to be time at the end for questions. So please, if you have any questions, wait till the end, and I'd be happy to answer those. So if we look at, should I plan for long-term care? According to the U.S. Health and Human Services, about 70% of Americans who reach age 65 will need some long-term care during their remaining years. And you'll hear me talk about some facts and figures. All the sources that I have will be referenced at the bottom of the slide. But about 70% of Americans who reach age 65 will need some long-term care during their life. Now, if we look at some of the trends in long-term care, let's look at an overview of claims from the American Association for Long-Term Care Insurance. If we look at the bar graph, you know, just like any thing with a you know, kind of a standard distribution, you know, you see in the middle part from age 75 to 79, 19%, 80 to 84, 27%, which really represents where most of the long-term care, the majority come, and then 85 to 89. And then you see it's kind of going down the hill. So it has that nice bell-shaped graph. What I want to point out for here is, you know, unfortunately, the time to start thinking about long-term care and long-term care insurance is not when you need it. Because unfortunately, by the time that you get to be 80, then it's likely too late that you've kind of aged out of being able to qualify for any type of long-term care insurance. So really, the plan, you know, is when you're working or at or near retirement. If you look at the next graph, a lot of times when people talk about long-term care, you know, in people's mind, really what they're thinking is, wow, this is for nursing home, or that's what I really think. But if you see, almost 3 out of 4 first benefit or first time claims for long-term care come with home health care. And that's really a trend that we're seeing in the industry. Like I said, I've been in the industry about 15 years. We've really seen the rise where people want to stay at home. They want to get that care where they're mobile in their house. We look at assisted living, 18%, and the nursing home benefits are actually the smallest portion, 9%. So as you're assessing, and only you know what's right for yourself and your family, but if you're looking at long-term care, some sort of policy, really maybe focus on something that includes that home health care benefit. So moving on, cost of care in Minnesota. Now, I'm from the Twin Cities. I live in Blaine, one of the northern suburbs of the Twin Cities. The monthly cost here, and likely if you've done any research on this, you've seen some of these numbers out here where for home health care service, the annual cost on average in the Twin Cities is $84,000 plus. You know, assisted living, we've had some of that managed care, $61,956 for a private room. And this is usually the number that, you know, I don't want to say scares people, but maybe gets their attention. Nursing home care for an annual cost. So if you have a semi-private room, $140,496 is the average for a semi-private room. And if you want a private room, which I would say, you know, from my experience working at that nursing home that my mom ran when I was in high school, most people would prefer a private room. You know, there's a cost to that. So in the Twin Cities, $156,660. That's the average cost according to Genworth's cost of care survey. Again, as we're going through, if you have questions, I'll be available at the end to answer any questions. If we look at the cost of care, now I'm sure we've all noticed the cost of gas in the last few years has risen. The cost of eggs, bread rises. The cost of my tickets to my favorite movie, Star Wars, has risen. If we look at the type of service, homemaker, home health aide, nursing home, the year-over-year increase, for the home health care, it's a double-digit increase year-over-year. And even for some of the more expensive things, it's an increase. So it is a single-digit increase. If you look at the nursing home private room, 2.4% year-over-year. Nursing home semi-private room, 1.96% year-over-year increase. And really, unfortunately, we're seeing with interest rates and inflation, these costs are going to go up. And I doubt we'll ever see in our lifetime that these costs will go down. If you look at some of the 5-year annual compounded growth rate, this is, you may have seen. I don't know if someone has. They might be on speak.
Who cares?
If you want to mute. I don't know if anyone can hear that.
Where are the charges against George W. Bush for invading Iraq under false pretenses and giving permanent normalized trade relations to China, which completely wrecked their economy? Where are those charges? Don't hold your breath. In your own country is not considered.
It appears somebody has their radio on in the background and they need to get muted.
Yeah.
Thank you for. But either way,
maybe who's like.
Not really the point here. Yes, of course you can.
There you go, gentlemen with the, okay, that might be it. Though it did sound like an interesting article. I don't know if that was Fox Business, but it sounded like it. So, okay, so we'll continue from there. So the last point I was going to make on this slide was if you look at the far graph or the far row, the 5-year annual compound growth rate, the blended rate is 5%. And you probably have heard that, generally the cost of care is increasing and it's roughly 5% a year. So going on, so planning for your long-term care needs. Generally when I work with agents and advisors and working with clients, like yourself, people that are on the phone here, I tell you what, many people know that there's a need for long-term care coverage. Okay, everyone gets it. No one wants to run out of money in retirement because of their nursing home costs or the cost of healthcare. I get that. Now, generally, planning for care falls into four main categories. And I don't need a show of hands to see what category you're in. But a lot of what I hear is, one, hey, my children will provide for my needs. Okay. Well, I tell you what, that is a strategy. I have 4 kids, 1 in college and 3 at home. I tell you what, I have a 16-year-old son. I sometimes he forgets to take the garbage out once a week. Love him, but kind of forgetful. My 20-year-old lives in New York. She's in college there. So that, and I have a 6 and 10-year-old, and it's kind of awkward asking if I could stay at their house instead of going to the nursing home. They're a little young for that conversation. But children providing for my needs, I tell you what, it puts a lot of strain both on the parents and on the children financially. So while that is a strategy, I tell you what, it's one that's fraught with emotional and financial danger. Okay. Number 2, the state will provide for my needs. I hear that, Jared, I'm just going to spend down to the Medicare asset level $2,000, and the state's going to provide for my needs with the Medicaid program. Again, that is a strategy. I tell you what, nothing against Medicaid. It's there as a safety net. It really is there to protect the people that need it most. But I'm going to tell you, you don't want the state dictating the terms of your care because there is no such thing as private room care there. And you really don't have a say in, say I want to be in my favorite town. I grew up here, but the state finds something 10 miles down the road in a different town. There's a good chance you're going to end up there. So saying the state will provide for my needs is a strategy, but it really is there for a safety net for people that truly need that level of financial help. Number 3, we have money set aside. And I think most of the people on the call and most of the people I talk to fall in category number 3, where they say, Jared, I have this bank account where I have, X amount of dollars set aside, or my grandma literally had money that was in a shoebox that was like under her bed that she had set aside. Again, it's good that there's planning for that, but really you want to work with a professional like the people at Clear Step to see how you can best leverage that money to take care of your future needs. Okay, so I would say number 3, you have the most flexibility and the most chance for success. And number 4, no plan for long-term care needs. If you've never made a plan for long-term care, don't be alarmed. A lot of people I talk to say, Jared, we're going to do this tomorrow. We're going to do this tomorrow. But I tell you what, not having a plan for long-term care, it is having a plan. It's just not a very good one because remember what we talked about, most of the care starts at age, 75 or 80. At that point, it might be a little bit too late for planning. And then you're really just doing what you can. So these are the 4 main categories for planning for long-term care. So if we look at the demographics, seniors spend more on healthcare. So if we look at food and beverage, housing, apparel, transportation, healthcare, and entertainment, as a demographic, it only makes sense, that seniors are going to spend more on healthcare than they would than people when they were younger. And if you look, transportation costs go down, entertainment costs go down, healthcare costs go up. So this just brackets. These are areas where seniors are spending money. Excuse me. All right. So types of long-term care coverage, and my firm that I own, I'm really agnostic. So I have traditional long-term care, life insurance with long-term care providers, and also the hybrid product. So really whatever product that you feel is good, very popular in the industry. And I'm going to give you some positives and negatives for each of these. Excuse me. Okay, first thing I want to talk about on this section is the partnership program. So the Deficit Reduction Act, which was signed into law on February 8, 2006, included Section 6021. This provision authorized states to offer special Medicaid asset disregards for persons purchasing and using qualified private long-term care insurance policies, which have come to be known as partnership policies. Okay, excuse me. Okay, so if you were an elder law attorney, that's probably a really compelling statement. What does that mean for folks like you and I? Here's what it means. Minnesota and Wisconsin are in this partnership program. So this is, for everyone that's here from Minnesota and Wisconsin. As an example, Emma's a client. She buys a long-term care policy, and day one she needs it. It pays out $100,000 in benefit. Well, because of the partnership program, Emma earns a Medicare asset disregard. What that means, it allows her to keep an additional $100,000 over the asset level before she, gets Medicaid. Before she has to, so she doesn't have to spend down to the $2,000 or $3,000 level. Really, what the states are doing, it's not bribing, because I wouldn't want that to be on a recorded webinar. But what they're doing is incenting clients to spend money on long-term care, and the less that the states have to pay out, the more assets that they have to give you. That's the partnership plan example. So traditional long-term care insurance. Okay, this is the original long-term care insurance, and much like myself, its heydays was back in the 1980s or the 1990s. Okay, it qualifies for the partnership program. No other product that I'm going to talk to or group of products do that. Has the most flexibility on level of care, where you can pick the elimination period, and you generally have some options on picking the benefit period. Okay, great. Sounds like the product, why is it only had its heyday in the 1980s and the 1990s? Well, here's why. Insurance companies underprice the product. If you have traditional long-term care, you've likely seen, 100% you've seen price increases on the product. They've been rampant, especially the last 5 years. At one point, there was 50 A- or better rated companies selling long-term care. Really now there's only 3 left. So price increases on the product. Now don't worry, Mr. and Mrs. clients, if you have these, they still and definitely don't get rid of it because they're very expensive to get again. Another big, I'd say, on traditional long-term care is if you don't use the benefit, you'll lose it. So if you pay in all this time and you're just really healthy, if you don't use the benefit, you lose it. So that's an overview on the traditional long-term care. Life insurance with long-term care riders. Now, because of some of the things that we talked about, if you don't use it or lose it and the price increases, insurance carriers came out with life insurance that had what's called critical care riders or long-term care riders. Underwriting is required on this. It is life insurance. Several very reputable A or A+ carriers offer this product. It has a death benefit, meaning that it is life insurance. So if you do pass away, your beneficiaries would get the death benefit income tax free. Let's say your death benefit is $200,000, for instance, and you have a qualifying event. You're confined to a nursing home. You can't do 2 out of the 6 activities of daily living, for an example. You can accelerate that death benefit for long-term care, meaning you can take the money out of the death benefit and use it for long-term care expenses. Now, if you do pass away, or when you do pass away, that money is deducted from the death benefit. But usually you can accelerate upwards of 25 or 30% of the death benefit for long-term care. The nice thing about this program is you really can guarantee the price with that, so there's no surprises or price increases. Again, not every program is like that, policy is like that, but there are some that can guarantee that price. Again, you really want to consult with an expert, your ClearStep financial advisor. Drawback on this one, we talked about the partnership program. This plan does not qualify for the partnership program. So this was life insurance with long-term care riders. The last product that I'll talk about is hybrid or asset-based long-term care. Now, in the past 5 years, this has really risen in popularity, kind of in conjecture with some of the rises in the traditional long-term care premiums. Now, these products can be life insurance or annuity-based. Now, the reason why this is important for you, the client, is this is the program. You can use qualified money, IRA money, for programs like this, or non-qualified, or like brokerage or cash money. Now, so that gives you, that's why it's called asset-based long-term care. Some programs have less underwriting than others, which is advantage. You know, for instance, if you were a type 2 diabetic that used insulin, a lot of times you'd be rated for life insurance, meaning your premium would be higher. With some of these programs, there's less stringent underwriting. And again, consult with your ClearStep professional. Now, there's a qualifying event to start premium. On all programs, it's usually some combination of you can't do 2 out of the 6 activities of daily living, you're confined to a nursing home, or you need home health care. One big advantage for this program is it can offer a full return of premium if you don't use it. And that's a big plus for consumers, that, you know, if you put money in and you don't use it, you could get all of your money back with a little bit of interest. A drawback on this one, doesn't qualify for the partnership program. So remember, traditional long-term care insurance is the only one that qualifies for the partnership program. So this is hybrid long-term care. So in closing, what are the next steps? You know, what can you do to protect, you know, yourself and your family? Well, congratulations, you're taking the first step. The first thing, very important, is to educate yourself on long-term care and the coverages. And then second, decide what strategy is right for you. You know, of the main ways to secure coverage, which one is right for my family? You know, third and most important, you really want to work with your ClearStep advisor to decide the best plan to put into place. Because I tell you what, I look at this stuff every day, and it's hard to keep up with all the products. You really want a trained professional there with you. So for considerations in closing, what type of care do I want for myself and my family? You know, how best to protect my legacy? What is the consideration, you know, for my children and or heirs? You know, how is this going to affect them? How is my care going to affect them? And lastly, how best to budget for future care? My name is Jared Taggart. Thank you for your time. That's my presentation. Thank you.
Well, thank you, Jared, for that informative presentation. Learned a lot from that there. Right now, we want to take a few minutes here, see if there's any questions from anyone in the audience on either the Medicare items or the long-term care items. Anyone have a question out there? If you have a question, unmute yourself. And if not, the ClearStep advisors here have relationships with Jared, and Nikki's been a presenter for us several times here. So we can always get your questions answered, get you connected up to the right people if you do have some concerns. But one last call here. Are there any questions from anyone in the audience out there?
Dave, hi, it's Cassandra. I just wanted to give a quick notice, I guess, or announcement that anyone who has an interest in having a healthcare cost analysis for their retirement conducted, we do have access to that. And it's the process of you fill out a health questionnaire, almost like if you were applying for insurance. But what they do with that is they take your health information, your age, and then they're able to run that through some proprietary software through Milliman. So it's almost like when you apply for life insurance, where they're able to give you a rate based on your health and age. They do something similar to estimate what your healthcare costs might be based on your age and health conditions throughout retirement, based on other people who have had similar situations. So if you want to get an idea of what you might be looking at for healthcare costs, and then look at what Jared was talking about with, maybe what kind of long-term care or what amounts might be appropriate, or knowing what to look for in your Medicare expenses and things and what you may want to have covered, that might be a helpful tool. So reach out to your ClearStep advisor if that's something you'd like to have done.
Thank you, Cassandra. Great thoughts there. Okay, any other questions? Well, I want to thank you all for being on the presentation this evening, and look forward to having you attend other presentations we have throughout the year. We have a couple more coming up this spring. Do watch for announcements coming out on those. And with that, I'll say, Nikki, you have any last things you want to say, or?
No, I'm pretty good. Thanks so much for having me. I appreciate that. And any questions that pop up on the Medicare health insurance world, just let me know.
Okay. And Jared, thank you also. You have any last comments, Jared?
No, I appreciate the time. Thank you very much.
Okay, well, thank you all for being on the presentation tonight, and have a good evening. Good night.